Our first video showed the problems people face while seeking treatment in private hospitals in India. Exorbitant overcharging, lack of information, unnecessary operations and tests, malpractice of every sort, and years of frustrating struggle in courts for victims of medical negligence and their families. How can these problems be fixed? Well, the government needs to put laws in place which make private hospitals accountable for their actions, ensure rate regulation and transparency in pricing, ensure evidence-based quality treatment, and finally, protect people at their most vulnerable, when they're sick and in hospital. Turns out that there's already an act to do all of this, the Clinical Establishments Act. Enacted by the Indian Parliament in 2010, it was adopted by 11 out of 29 states. In 2020, take a guess how many states have implemented this act? Yeah, you're right. None. Zero. Despite massive evidence of all the wrongdoings and the suffering of the people, not one state has taken this first step towards regulating the private health sector. In 2018, the National Human Rights Commission finalized the Charter for Patients' Rights. These are basically a list of guarantees about the kind of medical treatment people deserve as patients and human beings in healthcare facilities. The Charter has 17 crucial rights, such as the right to medical records and reports, to emergency medical care, to informed consent, to a second opinion. Now, based on this, in June 2019, the Union Health Ministry has released a shorter 13-point patient rights charter. This should be adopted and implemented by all the states as soon as possible. Ideally, they should be implementing the original NHRC charter, which is way more comprehensive. The government should also simplify the current grievance redressal process and ensure that it acts swiftly, fairly, and effectively to deliver justice to victims of malpractice and negligence in the private health sector. So what can you do to make sure that the government enforces these laws? Inform and educate. It's now time to put patients before profits. Let us come together to fight for the affordable and quality healthcare we all deserve.